As you guys know, I believe in less is more at times. Whilst my brain wants to go more, I actually do realise now, after 45 years, less is more. So when it comes to testosterone replacement therapy, we replace the testosterone and we replace the LH with HCG. Simples. If only it was that simple. So, what issues do we face? Estrogen. God damn you, estrogen. You're a pain in my butt sometimes. How should you manage estrogen? Well, from a treatment perspective, sometimes adjusting your injection frequency helps. Sometimes obviously lowering your dose helps. Sometimes switching the route of administration helps. So I am a big fan of subcutaneous injections. It doesn't work for everybody, but the majority of guys, it is a suitable, or shall I say, the gold standard route of administration, because it causes less aromatization and it's less painful. So nobody really wants to be pinning into their muscle multiple times a week just to achieve hormonal stability. People do, and as always, it's a benefits risk thing. So it's the lesser of two evils. So we slightly digress. So estrogen. What happens if we can't control estrogen from adjusting your dose, route of administration, and injection frequency? Now, an obvious comment is you should be trying to affect your estrogen through healthy living, weight management, having a clean, healthy diet that does not place stress on your liver, which increases aromatization. So you should be doing your part as well. Well, we've had great success from microdosing examestane. Examestane is a suicidal aromatase inhibitor, meaning it kills a little bit of the aromatase enzyme. It makes far more sense to me than using anastrozole, which is what everybody else uses. So we've been using examestane and we've been microdosing. So using a smaller than manufactured dose to achieve the desired outcome. We have had some guys who have borderline estrogen levels, and even with microdosing, that drop in estrogen would be too much, and obviously then they would have symptoms of low estrogen, which can be obviously as bad as having high estrogen. So it left us in a bit of a quandary, because the solution is to either increase the dose of the testosterone or actually more effectively increase the dose of the HCG, because obviously we know that HCG can stimulate aromatization of testosterone to estrogen within the testicles. So obviously complicating factors are you primary, are you secondary? So it's not perfect, but we have had success from increasing the dose of the HCG to then allow us to use an aromatase inhibitor. But I don't like that. It's bad medicine. So I again, less is more. So what do we have under our sleeves now? Proviron, Mesterolone. Proviron is a DHT-derivative. It has been used in testosterone replacement therapy back in the early days, but it's not really an effective form of testosterone replacement therapy. It's been used and abused by bodybuilders for that lean look, It has beneficial qualities of, again, acting as an estrogen antagonist. So not only does it increase DHT, which all the bodybuilders want, which obviously can improve libido, unfortunately it's not really a very good anabolic agent because it gets broken down very quickly in the muscle. But it's been used by bodybuilders to decrease estrogen, and it also binds to sex hormone binding globulin, and as we all know, that will cause an increase in free testosterone. So everybody's chasing a high free testosterone, normal estrogen and a high DHT, but we just want normal levels. So we now have Proviron, aka Mesterolone, as a tool in our arsenal to combat mildly elevated estrogen despite a optimal TRT protocol. So again, I mean testosterone, cypionate or enanthate, and HCG. I don't mean the garbage. So yeah, we will be trialing Mesterolone in our guys with borderline elevated estrogens, and we will be presenting that data in the future to hopefully adjust, improve, enhance practice within the medical community. So yeah, watch this space. There's more to this story. So what else are we going to be using Proviron / Mesterolone for? Shock horror, TRT doctor does not want to put you on testosterone replacement therapy. Oh my God, bad for business, stupid idiot. I don't. There are enough guys out there that need my help than to be putting people inappropriately on testosterone replacement therapy. So, what issues are there out there now that are minimizing your chances of having optimal male androgen levels? Well, the obvious comment is estrogen, because estrogen feeds back to the hypothalamus and pituitary and has a negative effect on that. So then if your estrogen is high, then you will not be sending luteinizing hormone and follicle stimulating hormone down to the testes, and ergo an artificially elevated estrogen will have a negative impact on your testosterone production and subsequent well-being. We don't want that. So what should you be doing? You should be trying to minimize estrogen. So as before, ad nauseum, weight management, healthy lifestyle, nice clean liver, avoiding booze. So when you come and see us, do not expect me to say, oh, bang on Proviron, because that's a medication that's going to sort you out. We will not do that, okay? So you need to help yourself. So you need to have explored the reasons why you may have an elevated SHBG and address them. I'm not a shop. So pathologies, again, we know about mild liver dysfunction, hyperthyroidism. So if you address that, your SHBG should decrease and hopefully allow you to have some more free testosterone and be healthy, funnily enough. So high SHBG, it is going to be a treatment choice for guys with elevated SHBG that cannot be reversed through lifestyle modification and addressing reversible causes. It's not the cure. You need to address the causative agents, and we will only prescribe you Proviron / Mesterolone if medically, clinically indicated. I'm sick of this healthcare society that is a sales consumer relationship where you go to the doctor and say, oh, can you sort me out with this please, because I can't be asked to do the work myself. No, it doesn't work like that. We're here at the Men's Health Clinic. You will have to put the work in as well. Estrogen, and again, decreasing aromatization is cardinal to optimal HPG access health. So you need to try and decrease your rate of aromatization. So there is a cohort of guys out there, and a growing, alarming cohort of guys out there that have elevated estrogens. So yes, you should adopt a healthy lifestyle, weight management, all the usuals. Sometimes it's not quite as easy, because obviously what's happening is you are a chunky monkey, and that elevated estrogen is suppressing your HPG axis, and you haven't got the motivation or ability to do what you need to do to lose the weight, to address these issues. So it's not always that clear cut and not always that simple, but we will be potentially using it as well to help lower estrogen, but it will be part of a lifestyle management, nutritional advice. It will be a holistic approach. It won't be, again, you come in to see me going, can I bang on some Proviron? The answer will be no. So yeah, I'm super excited to announce that the Men's Health Clinic has Proviron, and it will be available to our patients based on clinical need, not I want it. Is it God's gift? The answer is no. Okay, every medication has risks. Okay, so we all know the risks of excess DHT, oily skin, acne, male pattern baldness. All that's really a bit of a misnomer, because actually it's primarily genetic, and potentially worsening of prostate symptoms. And again, guys on TRT, we're supposed to caution them about them having prostate symptoms and it being a caution for TRT, but 99 times out of 100, funnily enough, normalizing your male androgen levels has a positive impact on your organs, such as your prostate. So the old caution of if you have an IPSS score of above 17, you should think long and hard about whether you should be giving TRT. Well, that's garbage. So yeah, we have found that testosterone replacement therapy improves prostate function, and ergo, when you're giving TRT, you are increasing DHT. So what else do we have to worry about? Well, it's a DHT derivative. It isn't pure DHT, so it has to be metabolized by the liver. Whilst it doesn't have the horrible compound that does cause liver toxicity that most of these oral anabolic steroids does have, it is still something that we need to monitor to make sure that we're prescribing it safely and effectively. So you will need to monitor your liver function whilst on therapy. It can increase your LDL, so your bad cholesterol, and decrease your HDL, so your good cholesterol. So again, should be prescribed under medical supervision only, and you should be regularly monitoring your lipid profile / status. So less is more. Proviron is going to be a useful adjuvant to our traditional therapy, and I'm super enthused to be able to say that it's now available at the Men's Health Clinic. So there you go, guys. Have a good Saturday. I'm going to say peace out and Lily's going to kill me. All right, cheers guys, ta-da.